Hey everybody, it's just Dr. Bart here, just to discuss laser and laser treatments. So, per the APRA guidelines with the laser or energy sources, we need to do a consult first for your first treatment. So, the reason why we do a consult before having the laser is so we can go through all the different types of things that can happen and risks and your skin type. So, skin Fitzpatrick, it goes to 1 to 5, and that's from lighter to darker color. The 4 and 5s, there's more risk with laser because of the heat. So you can get hyperpigmentation or melasma flare up. So that's why we have the radio frequency machine, which, still ablates your skin. So you still get better tone and texture. However, you don't have that risk of melasma or hyperpigmentation. The other thing is to go through is like the other things like, how often are you out in the sun? What's your past medical history? Have you had laser before? Have you had any adverse reactions? What are the contraindications, which would be like if you're on Roaccutane or been on Roaccutane recently. Other contraindications could be like immunosuppression could be one. So we look at all these different things, and then after that, Sharon will go through like, what do you want? So what type of laser, what type of treatment? So, and everybody's different. So someone, it could be like their under eye area is a concern, or someone it could be just their pigmentation on their face, the sun damage. Or another person could be their pore size, and the tone and texture of the skin, which would be fractional laser. So all this is done through the APRA guidelines. So we follow this sort of this like consult is very important to, and then we do an informed consent. And then afterwards, we talk about downtime. So, how much downtime do you have? Because some people, they might not have 3 days downtime, they might not have 5 days downtime. So, it's all dependent on that. And we talk about what are normal reactions after a laser and what are abnormal reactions after the laser. So, normal reactions are you can get swelling, you can get peeling off or stuff if it's fractional laser or so on. But if it becomes like a infection or an hypersensitive reaction, they're things we need to know about. So we give you sort of information on that too. So with the laser devices, it's very important to follow the guidelines per APRA that we do the consult first, not the laser first. And the reason we do that is run through all your medical history, run through what type of treatment you want, what's going to get you the best results, what are the complications, what are the adverse effects, and what is the downtime, and what is the aftercare? Like, what do you have to do for the aftercare? And major part of the aftercare is what type of cream, if it's topical or not, and keep out of the sun and different things like that. So, yeah, with the laser consult, it's important that you follow sort of the APRA guidelines and have the consultation first, because there are risks with laser. You can have hyperpigmentation, you can get burns, you can get